Most of my career has been in maternal child, which means pregnant women, infants. Also did some time in Peds ICU. I worked in the pediatric intensive care unit and also was a school nurse in Oak Park for about 6 years. So most of my career is just kind of in this area. So for the Oak Park Health Department, I work with a couple of programs, and they're focused mainly on pregnant women and infants. And so that's kind of why I'm talking today, because I do the gist of my work, or the important piece of what I do is monitoring infants and children, their growth and development. I'm going to use infants a lot, and I'm sorry, I mean children as well. It's just that I work mostly with infants. So I wanted to talk to you today about growth and development of your children and why you play an important role. So I just want to break it down. It's obvious. When we're talking about growth, we mean the physical growth of your child. And when you take your child in for an appointment with a doctor, your well child visit, the 2-month, 4-month, 6-month, one of the first things they'll do is weigh and measure your child. And obviously this tells us things about baby's the child's nutritional status, and it also tells us about their general health. But development is different. Development refers more to what your child can do as they grow. Is your child able to do increasingly more complex tasks as they grow older? And that's a little bit grayer than just the number of, what's the number of their weight or their length. So development is different. Sorry. So when we're talking about development, your doctor or your caregiver will assess it in different categories. And the first category that the doctor will talk to you about is communication. How is your child or infant communicating? Are they making gestures, cooing noises as newborns? In the toddler stage, are they starting to say words? Are they pointing at things or pulling you to something that they need? The other area would be gross motor. Those are the larger muscles. Larger muscles that would enable a baby or child to stand, walk, the core muscles. Fine motor is another area. Fine motor is more like the muscles in the hands or the hand manipulation. So is your child or infant manipulating toys, even at as early as 4 months? A baby might be able to hold a rattle, but are they looking at it? Are they actually acknowledging that they have something in their hand? So that's a milestone. Getting ahead of myself. We also look at cognitive ability, thinking skills, problem solving. That sounds funny for infants, but really even at 6 months is, when a baby's, when they're in that on their back in that position where they're touching their toes and putting them in their mouth, that's a problem solving skill. They're almost realizing, hey, these belong to me. I'm a person. I'm not just one with mom. Because really early in life, a newborn isn't able to distinguish whether they're a different entity than their caregiver. So that's all part of that cognitive ability. And then social is another piece. How does baby interact in their environment? One of the questions we'll talk about later when I'm doing an assessment, I'll ask a parent, have you put your baby or child in front of a mirror? What do they do? Are they acknowledging that there's an interaction there? Are they cooing? Are they reaching out for that mirror? That's an early social skill. So I kind of did jump ahead a little bit. So those are the areas that we look at when we're kind of monitoring growth and development of an infant or child. And really in the first 3 years of life, 3 to 5 years of life, we really focus on growth and development because a newborn's brain, for example, is about 25% of its approximate weight. It'll be as an adult, so it's 25% of its approximate weight. But by age 3, the brain's grown so dramatically, it produces billions of cells and hundreds of trillions of connections or synapses. So it's neurons in the brain that are kind of woken up during those years. And they develop and wake up, getting ready to take in information. It's just so rapid during those years. And it's also impacted by a couple things. The brain growth and development is impacted, first of all, by biological factors, which is kind of our genetic makeup of how our brain is going to develop. But also our environmental stimuli. What kind of stimuli is that infant and child getting to help wake up those neurons in the brain? And that's where you as parents, caregivers, come into play, because it's our job to really give that stimuli and make the most of every opportunity, all our interactions with our child. So the growth and maturation is so important between 0 to 5 years. So one of the most essential, I kind of like this piece, I hope we're not going on too long about brain development, but there's a brain development piece that it's called serve and return, which means the interactions between your child and their significant other, or their caregiver. Sorry. So even when a newborn, reaches out, or a baby reaches out by babbling or facial expressions or gestures, the adult naturally responds, and we kind of vocalize back to our baby. And this is what I'm talking about, that back and forth process that is fundamental to connecting and formulating the wiring in our child's brain. So I want people to realize that even with your toddlers, that probably your everyday activities are impacting your child's growth and development. And the more we get into it, you'll maybe be able to see that even things that you're doing in your everyday life, just by tweaking some of your activities with your children, you can make them focus a little bit more on growth and development, and developmental skills, rather. So, kind of a disclaimer, every child develops at their own pace, and it is impossible to tell exactly when a child will learn any given skill. However, we use developmental milestones to give us a general idea of where this child, to give you a general idea of when to expect a specific skill to be accomplished. So things like taking your first steps, smiling for the first time, waving bye-bye, are all called developmental milestones. And as I said, each child will kind of develop at their own pace, but we want it to be within a specific time frame. And they learn these milestones, they accomplish these milestones rather through play and interacting with their caregivers, parents, I should say. On your table, I did give you a list of developmental milestones. They start at 6 months, but we even have some for 4. But this particular, one thing I want to point out, you'll see that my information is from, on the bottom of the paper, you'll see that my information is from the CDC website. And there's so much information out on the web, and I always point out to my patients, be aware of where you're getting your information. There just could be anybody behind a keyboard, and so especially when we're talking about a topic like this, make sure you're going to a reputable website. CDC is wonderful. Center for Disease Control, it's like the mothership of information, medical information. Also, the American Academy of Pediatrics has a great website. On the back of that first page, I give you a lot of resources for growth and development. They're all reputable resources. One in particular, the Center on Development at Harvard University, they even have little 3-minute videos that talk to you about growth and development. It's really good. But anyway, so let's look at some of the milestones. So this is on the first page. At 6 months, a baby should start responding somewhat to their own name. They would respond to interactions with other people. So if somebody's smiling at them, they'll smile back. I think 6 months is such a fun age. They're so interactive, but they can't really get away from you at that point. They're not fully crawling, so it's kind of like you can have fun with them and they're not going anywhere. But I'm the mother of twins, I should have mentioned that. So I've got a 19-year-old and twin boys that are 17-year-olds. So I remember those days of having a 2-year-old run around and trying to care for infants. It's a blur. It's a whole blur. Anyway, so copying sounds at 6 months, they should be copying sounds. And one thing I'll caution you, if your baby just turned 6 months, maybe just turned 6 months 2 days ago, I wouldn't expect baby to accomplish every milestone under the 6-month section. Give baby some time, work with baby. How do you do that? Well, tummy time, giving them toys to manipulate. As I said, some of your everyday activities are probably more developmentally focused than you even realize. So at 1 year, they use simple gestures like shaking their head no, bye-bye. They should be saying, you know, mama, dada, and responding even to different inflections in your voice, like no, or, you know, different sounds of your voice. They should respond to a few simple requests. And then we go further from there. I'm not going to read them all to you, but this gives you some of the milestones. On the second page, they get a little bit more involved. This is your developmental journey that I included in the packet. And one thing about milestones, you know, I like the reference, milestones. What is a milestone? It's a marker in the road, and that's what our developmental milestones are for our children. It's a marker on where they're at in their journey of growth. So I thought that was kind of interesting. So so let's say you're looking at your own child and saying, you know, I'm not sure. He's not saying as many words as I think he should be, or you know, my 6-month-old isn't really sitting on his own yet. At 6 months, they're sitting in that kind of tripod position, you know, with support. But let's say your baby's not doing that. What do? Well, you want to obviously talk to your doctor about it. It's really, I think as a parent, if I noticed that my child wasn't meeting a particular developmental milestone, my first thought would be worry, concern, worry, and that's natural. But the thing about when I talked about brain development and how rapidly the brain is growing at this time, by the same token, it's ready to take in so much information that if we can catch developmental delays early, they're going to respond early. So there's addressing developmental delays between 0 to 3 years old is called early intervention. So early intervention is just what it says. It's early. We want to catch these guys early so that we can fix or give them the tools to improve their developmental skills. So you notice a problem, don't wait. Don't fester. Go to your doctor and see about getting what's called an evaluation for your child. Everybody in this area, it's the West Cook area, would be referred to an organization called Child and Family Connections. And what they do is you call them, your doctor can call. Either way, you can call on your own. But you voice your concern, and they'll do what they call intake. They'll talk to you about it, and then they would come out and do an evaluation. And you're looking to see, does your child need a little extra help, and maybe through physical therapy, speech therapy, developmental therapy. So there's lots of help out there. Now, if your child is already 3 years old, and you're noticing delay, then you would go to your local school district for evaluation. So Children and Family Connections is for 0 to 3. Once they're 3, they go to the local school district. Same evaluation, just different place. So I don't want anybody to, you know, fret or worry. If you do notice any delay in your child, don't wait. Speak to your doctor and get an evaluation. But I did talk a little bit about, let's say it's earlier in that particular stage of development, and you're seeing some things, some milestones that your child hasn't accomplished. What can you do? Well, in the back of your packet, I gave you, I think, up to age 4, maybe, of developmental activities. Activities you can do. The nice thing about these activities are they're kind of homemade games and things that you can do. I think I gave you as early, it's 4 to 8 months. So you can do things with your infant, your child, to help them improve their developmental skills. I go into homes of people, and let's say I do a developmental evaluation. I'm going to get into that in a moment. This happened to me last week. I went into the home of a mother who had a 6-month-old. That must be my favorite. My favorite example. Anyway, this baby was 6 months old, and baby wasn't doing any, didn't really have much core strength. She was not sitting on her own. She was kind of tip over. No really interest in even trying to. Mom was alarmed. I was concerned, but I happened to have to go back there in a week. So I said, you know what, I'm going to come back next week. I gave her the developmental activities and just simply told her, Are you putting your baby on the floor? Is she having any time on the floor? Are you putting toys in front of her that she might like, that she's going to want to try to get to? Much of this is opportunity. Are you giving your baby or child the opportunity to accomplish these skills? So I went back in a week, and honestly, she was doing almost everything she was supposed to. We went ahead and did the evaluation anyway, just to be safe, but she was fine. So another topic on the 6th month is we're looking at the fine motor skills, and one of the questions is, does your baby reach for a crumb or something the size of a Cheerio? Well, most of my moms of 6 months old go, I don't give them little things like, oh, it's a chokeable. This I know. But try it just while you're right there. Give them opportunity, because those are the fine motor skills that's a way to develop rather fine motor skills. Another one is, are you introducing the sippy cup at about 6 months? I know this is preschoolers or toddlers, sorry, but I'll get into some for them. But introducing a sippy cup at 6 months is a great way to get that fine motor skill going. They have to grab at the cup, they have to try to put it in their mouth. I usually tell moms it's not a nutritional thing at that point. It's just playing and, cleaning up a mess after. So I was going to go forward and just tell you a little bit more. When healthcare professionals, when we're evaluating a child to see if they're meeting their developmental milestones, there's different tools that we use to evaluate. One of the most popular ones, I put an example on each table, is called the Ages and Stages questionnaire. Parents can do it as well. And some doctors' offices are even giving their patients this to fill out in the waiting room while they're waiting for their well-child visit. And then the doctor, in a perfect, wonderful world, would go through this with you and discuss. I know there's just not a lot of time. I think doctors don't have a ton of time during their well-child visits, but ideally it would be great if they could go through this step by step. Or if you can even download this on you can Google it and download it as well. But you can see it in this, so it goes by 4 months, 6 months, 8 months, 10 and 12, and then goes all the way on to, I think, age 4. But this particular tool goes through all the areas that I was talking about. Now I've got a 12-month here. So this is 6 questions under communication, then there's 6 under gross motor, fine motor, and so on, problem solving and personal social. So communication. For a 1-year-old, the question asks, if you ask her does your baby at least play one nursery game like peekaboo or clap your hands? That's one for, when I go into homes of, I have some young girls on my caseload. They're young, they're not, first-time moms, they're not really interacting in this way with their child. So look at that. Just by playing a few nursery games, you're addressing some developmental milestones there. So, even the little things that you're doing are important. So in this particular tool, the parent could say yes, sometimes, or no. So for every yes, you get so many points. For every sometimes, so many points. And then what we do is we add up the points. And at the end of the assessment tool, we would plot those numbers. And if the numbers are here in the shaded area, we would say, let's call doctor, or let's refer to early intervention. And if not, then babies, well, we don't say normal, we say on schedule for growth and development at this time. So this is one, if your doctor gives you this is an assessment tool for growth and development. So, as I said, every child does develop at their own pace, and it's really impossible to tell exactly when your child is going to meet a particular milestone, but you do want to make sure that of the milestone that you're concerned about, that your baby or child is meeting it, like within a month or so of your assessment. And don't be afraid to talk to your doctor about it. If you have concerns or delays, definitely talk to your doctor, or you can call on your own. I did include on your tables a bookmarker. There's an organization in Oak Park called the Collaboration for Early Childhood. You may have read about them, and they were in the journal, and they were trying to get public funding a few months ago. They, anyway, I digress. They work with preschools and daycares within the Oak Park community. They put together this growth and developmental assessment book. I'm really low, otherwise I would have brought you your own copy. But if you use that bookmark to go on their website, you can access the entire book online. And it was put together by local pediatricians, and it gives you some guidelines. So between 0 and 3 months, what your child should be able to do. What I like best, again, is on here is how can you help me? So you can go online and look. It goes to up to age 5. So you can go online and find some. So for a 2-year-old, 2 to 2.5-year-old, what can my child do? Well, name clothing items and know their uses. Know that these are my shoes and I put them on my feet. They use 3-word sentences along with pronouns and tenses. They should be able to say their name. They get upset when they don't understand, when you don't understand them. I remember that. That was a rough one. I had one twin that really had great vocabulary and the other one didn't. And I think for the other twin, his whole second year of life, he was on the ground rolling in a tantrum because no one could understand what he was saying. So that one brings back some great memories. Anyway, so undress themselves, run, avoiding obstacles, and stop without help or falling down. So in this particular tool, as I said, what I was just reading is what your child should be able to do during those times. But the best part is how can you help them? So talk to me about my emotions to help me label them. Read children's book about emotions and feelings. Give me more complex instructions and help me when I struggle to understand. Draw with me. So these are, kind of just everyday interactions. But if you do these things with developmental milestones in mind, they're being done with a purpose. So feel free to go on that website. Also, just like an FYI, on the same website, there's an early childhood resource directory. You're in here. Your group is in here. So it gives you local resources that you can access, just as a side note, if you're interested. Again, it's really low in copies, but if anybody needs a copy, I can share. Otherwise, it's available online. I hope I didn't forget. Does anybody have any questions, or anything you want to share? Oh, thank you. Oh, I skipped ahead. There's a few things we talked about when to call your doctor. There's some that are kind of red flags that I did want to talk about when to contact your doctor. Some focus a little bit more on infancy, but I think they're helpful. So contact your doctor if your child uses one side of his or her body more than another, does not appear interested in interacting with family or peers, loses a skill that they once had, rather loses speech or a motor or social skill that they previously had accomplished, covers their ears with a sound that's unexpected, tilts their head to see objects, or brings something, things close to their face when reading, does not imitate sounds or actions, and does not respond to his or her name. So you want to really, those are kind of red flag areas you want to bring up to your doctor. But again, as I said, 0 to 3, that brain is just developing very rapidly, and many things can be addressed and improved with early intervention. So we don't want to have to be worried about early intervention. They do great work, and kids respond very well. So, thank you. They were a little bit more, they're not really age specific because they're just, for example, the one that says uses one side of their body more than another. I mean, that's kind of something that at any age would be of concern. Another example was if your child loses a skill. So obviously that you want to address that immediately no matter what the age. months where that starts. So, you know, I guess that's a tricky one because when they're infants, yeah, a little bit. But I think the responding when they're infants in that infancy area, you know, 6 months, 8 months, they should respond if they're spoken to for the most part. You know, not like yes, mother, but you know, just reacting to somebody talking to them in a familiar tone. Yeah.
What's the concern with the ears? When you were saying that they cover their ears?
A couple things. With covering the ears, sometimes that's a developmental issue where you might see sometimes in autism or kids that have sensory issues. So it could be something as simple, but it could be medical too. A lot of things you have to resolve the medical before you look into developmental issues. So it could be a medical issue. It could be fluid in the ears. Sometimes when they're so inflamed, they're sensitive to sound and touch. So covering the ears first, that's why you would want to talk to your doctor first, because you want to kind of rule out medical issues. Is there fluid in the air? Is there some type of abrasion in the air or something that's making the ear sensitive to loud noises? Because, you know, hearing works through vibration. So when that, the vibration of the sound is conducted through the ear, if there's a medical issue there, you might get some discomfort. So once you kind of talk to your doctor and eliminate the medical piece, then you might look into developmental issues, autism, or just some sensory integration issues.
Would a skill that a child lost include something like they're starting to refuse foods that they used to eat, or starting to like chew up and spit out foods that they used to eat?
You know, that sounds pretty typical of, yeah. I think, right, exactly, that's that rolling child. No, I don't think so. It is, and then again, you have to kind of, that's a red flag in a sense, but you do, again, look at the whole picture. That sounds kind of, I don't know, necessarily age appropriate for toddlers, but it's expected. But are they still able to hold that spoon while they're flicking the food that they don't want to? It's the motor skill, right? So, losing skills, yeah, the food, I just probably say no, unless you notice, unless we came to the point where they're really not, getting their proper nutrition because it's getting in the way. And, that could be a real concern, so we just want to kind of look at the whole picture. I know it can be dicey, it's a little bit scary to think, oh, my child stopped eating, or he used to skip for me and now he won't anymore. What does this mean? So we do have to, just kind of keep yourself aware, and, I think in the toddler age, there's always that autonomy, that kind of battle. That's something that I was going to talk a little bit more about. We were talking about maybe not really differentiating themselves between them and their mother, and it's at that, let's see, I had a specific age, 6 to 7 months is when they realize they're separate, and that's exciting. I love that age. As I said, you're seeing all these new things happening with your child, but then all of a sudden, separation anxiety kicks in. Oh, we are separate, and you're leaving, and so that's a whole nother issue. Then once they realize, oh, I can drop, mom's going to come back and get me. Well, then now they realize, ooh, I'm independent, and I'm going to let everybody know it. That's that toddler stages where they're growing so independent, and it's blossomed to the point that they want things, they have temper tantrums. So it's almost careful what you wish for, but that's all developmentally on target, and it's just part of their growth. Thanks so much, everyone.
I think the group leaders have some group discussion questions, and we can sit at our tables for a little bit, and then while I have the mic, actually, if you're staying and your kids are going to stay, make sure you brought them a lunch, because they tend to get hungry between 11 and 1, and then miss down out there and scrambling. So hopefully